Hello and welcome to fibamu. I'm Inga, physiotherapist, and in today's video I'll show you 10 special tests to better identify the cause of your shoulder pain. The thing is, if you want a treatment that actually works, you need to know what's causing your pain in the first place. So let's find out together. The shoulder itself is a very complex structure, and the pain-free range of motion doesn't only depend on your glenohumeral joint, but on several structures. If we're looking at your shoulder pain, it's also important to take your patient history, so if you had any traumas, your age, all these things into account. But for now, in these special tests, we're looking for differences in range of motion from the left to the right side. We're looking for example, shoulder blade winging or compensatory movements like you're shrugging up your whole shoulder, the reproduction of pain, and or weakness, okay? So let's jump into our first special test. The first condition we're going to look at is the impingement syndrome. Your tendons or your bursa can get impinged between your acromion, which is the top of your shoulder blade, and your glenohumeral joint. So there isn't a whole lot of space between those two structures already, but in certain movements, the space even decreases further. So in this first special test, we're going to decrease the space to stress the tendons and see if the pain might be coming from here, okay? So the first test is the painful arc test. So for this test, please go into a standing position, and you're simply going to bring both of your arms next to your body, and then in a full circle, you're going to lift them up until they meet again on top of your body. A positive test is typical a pain-free range of motion until about 45 to 60 degrees. Then you enter a painful area up until, let's say, 120 degrees. Then it becomes painless again. And sometimes you feel a pain up at 170 to 180 degrees. Again, at this test, we're also looking for differences between one side to the other side and a reproduction of pain. So our next test is again an impingement test. It's a Hawkins Kennedy test. For that test, you're going to bring your arm into a flexed position, like a 90-degree flexion with a flexed elbow, just like that. Then you're going to internally rotate your shoulder, so you bring your thumb to point downwards. If this is recreating pain in your shoulder, it again points us towards the impingement syndrome, okay? If you want to learn more about these conditions, for example, if these tests were positive, make sure to subscribe to our channel and hit the bell down below, since we'll be making videos on each of these topics individually in more detail, and most importantly, tell you how to treat them, okay? Maybe they are already linked down below, so have a look as well. And let's continue with our next condition. So next, we are going to look at rotator cuff injuries. Your rotator cuffs are 4 muscles that provide strength and stability to your shoulder joint in movement, okay? These 4 muscles are the Infraspinatus, Supraspinatus, Supscapularis, and Teres minor muscle. Each of these muscles has an individual test to test for integrity and function. So let's start with the one that has most commonly tears, which is the supraspinatus muscle. This one will test with the empty can test. For this test, you're going to elevate your arms as such, and you're going to pretend to hold a full can, okay? Then you're going to pour out the can, so you bring your thumbs facing downwards. Maybe this is already recreating pain in your shoulder, but maybe not yet. But you might know which shoulder is hurting you more, so you're going to the side and you're going to apply a little bit of pressure, resisting with the arm to not let it be pushed down, okay? A positive test is, again, the recreation of pain in that shoulder. And this indicates for often a weakness, a tear, or an inflammation in that supraspinatus tendon or muscle. So next, let us test the infraspinatus muscle. For that, we're going to resist external rotation, okay? So you're going to take your arm next to your body in this position, and you're going to give some self-resistance, or if you have a friend, you can ask your friend to place a hand here and resist your movement in external rotation, so in that direction, okay? You want to go there, but you don't let yourself. And we're looking for weakness actually here. So pain, but mostly weakness, so that you have really difficulties to push the arm in external rotation, okay? So our third rotator cuff muscle is the Supscapularis muscle. Let's test the integrity of this muscle with the lift-off test. For this test, you're going to take your arm that hurts and bring it to the small of your back. From here, try to lift off the hand and go back, okay? So we're going for this lift off. You can try it also always to compare with the other side. And again, we're looking for weakness or a reproduction of pain in this movement. The last rotator cuff muscle is the Teres minor muscle we want to test, and we're doing this with the Hornblower test. For the Hornblower test, come with your shoulder into this position, and then you're going to go backwards, okay? The original test is again with resistance, but if you don't have anyone to help, just go a little bit backwards yourself. And again, you're looking for pain, a reproduction of pain, or some kind of weakness, okay? Very good. In this test, we're looking primarily for the fear of luxation. So maybe you have luxated your shoulder in the past, and while doing this next test, really be careful and don't go further than you feel comfortable with, okay? And again, the positive sign is also that fear and you not wanting to go further. Often this test is performed on a bench or laying down, but now when you're self-testing, you can also do it in a sitting or standing position. So as I said, the test looks very similar. So you're bringing your arm in the same position and slowly, slightly moving it backwards, okay? And again, if you're very fearful that this will luxate, this would be a positive sign for the apprehension test. So our test number 8 will be testing your AC joint with the pull apart test. Oftentimes people injure the AC joint when they fall onto an outstretched hand or they fall onto the side of their shoulder, and the AC joint, which sits here on top, gets injured or smashed up, okay? So for this test, you're going to take the hand of the arm that's painful and you're going to interlace your hands as such, okay? From this position, you're going to pull apart. So just move with both arms away from each other. And if this is recreating pain in your shoulder, we have a positive sign for an AC joint involvement. Next, we're going to look for a labrum involvement with the O'Brien's test. Oftentimes when we injure our shoulder, our labrum or the ligaments around our labrum get injured. So for this test, you're going to stretch out your hand in front of you with your thumb pointing upward. Then you're going to bring it across your shoulder and simply point the thumb downwards. If this is recreating pain in your shoulder, you have a positive sign for the O'Brien's test. So in our last test, we're looking for frozen shoulder or osteoarthritis with the shoulder shrug test. For this test, please bring your arms next to you like that and then elevate your arms until here and hold them here for a moment. And then just simply bring them back down. A positive test, a positive shrug sign test, would be if you are unable to lift them without the help of your shrugging up your shoulder. So it would look something like that, and that would be a positive test and indicate or point us towards a frozen shoulder or an osteoarthritis condition. So there you have it, 10 tests. I have a little bonus for you, so you don't forget that something that is hurting you in your shoulder might also come from somewhere else. So we're testing for cervical radiculopathy. For this test, please turn your head towards the affected side and then tilt it backwards a little bit. A positive test would be again the reproduction of pain in your shoulder. What this test does is it decreases the space you have in the foramen of your cervical spine. And this could lead to shoulder pain. So it's really important to also think holistically and keep in mind that shoulder pain might be also coming from somewhere else in your body. So I do encourage you to watch also our detailed videos to see a little bit more tests and understand the condition you're struggling with a little bit better. And of course, most importantly, learn how to treat them, okay? So I hope you found this helpful. Thank you for being here with me. Thank you for watching this video. And don't forget to like and subscribe. And then I hope to see you here again soon. Bye.